Dr. Dan Yachter, the chiropractor. Happy Sunday, everybody. Praying that everybody's doing well. And we're going to talk about my worst, I guess you could say, earthly fear, corporal fear. Not heavenly fear. No fears there. What is my worst fear? And I would say it's a physical one. And I would definitely say it's brain diseases. Specifically, the number one category of all brain diseases, Alzheimer's. Good morning, CC. So we're going to talk about this. We're going to talk it down a little bit because millions, tens of millions of people have been or will be diagnosed with dementia, Alzheimer's dementia, and so many other forms of brain disease, including Parkinson's and Lewy body's disease, all these different things that are a combination of Alzheimer's and Parkinson's. And typically Parkinson's and Alzheimer's eventually will grow together. And this is tragic, these brain diseases, millions upon millions of people. And what's happening in medicine, all these medications are coming out designed to treat dementia. And none of them have had any substantiated or documented proof of efficacy, of actually working. And the reason why is all of, and you may have heard this word before, all of the research and science has been targeted and focused on beta amyloid plaquing, which is entanglement of the neurons, the dendrites, and then inside of the cells themselves, you have things like tau plaques, these neurofibril entanglements, and beta amyloid plaquing has been implicated in the cause, the formation of dementia. And what you're going to learn at the master class that I teach, it is just basically the residue or the residual effect of something more insidious, nefarious, inflammation. We're going to be talking about that. But millions of people are told that nothing you can do about it except do drug treatment and therapy because it hinges upon you developing a brain disease, especially Alzheimer's, hinges upon you having the wrong genes, ApoE3, ApoE4. This is what medical science pins it on. But, in fact, it has been proven over and over and over and over again that lifestyle activities, what they call epigenetics, above and beyond genetics, can turn on or off these genetic propensities for brain disease. It's been proven. In fact, exercise, plenty of research studies, projects have shown this 20 to 40 minutes of weekly movement exercise, specifically resistance training, muscle training, can reduce the risk of developing Alzheimer's, really any form of dementia, any form of brain disease, between 40 and 60% if you're consistently exercising, moving, doing the right type of movement. Pretty amazing stuff that all these brain diseases that actually before the first symptom arrives, you have a neurologist in front of you diagnosing you with Alzheimer's or any form of dementia, or a relative, a family member, a spouse that starts noticing signs of memory issues, cognitive impairment. The brain issue itself, the disease itself, has been developing, growing 10, 20, 30, 40 years prior to the first recognizable symptom, even by the highest level trained neurologist in the world. So these things start developing decades before the symptoms arrive, and that's why we're so adamant about the community, our patients learning, what are brain diseases? How do they develop? How do you know they're coming? Decades in advance. And what are the lifestyle changes you can make to make sure your brain stays healthy, or maybe gets healthy and then stays healthy? Exercise alone, moving your body. That's why first thing I do almost every morning, especially this morning, I'm on my treadmill. I do my HIIT, high intensity interval training, moving rapidly, sprint, 30, 60 seconds, relax. That's actually one of the best ways to feed your brain and your mind with oxygen, right? So 40 to 60% decrease in risk of brain disease, or actually there are doctors, scientists around the world that are slowing down, reversing, stopping brain diseases. One of the key things that they use is movement, exercise. What are the things that happen when you're moving your body, when you're oxygenating your body? There are a lot of things that happen, one of which many of you guys have heard me talk about at the master classes, BDNF. It is a protein, it's a peptide, brain-derived neurotrophic factor. It is Miracle-Gro. It is fertilizer. They're steroids for the brain. The one part of the brain that's implicated in all memory issues, brain diseases, dementia, the hippocampus. The hippocampus is BDNF, which is released when you're moving your body. fertilizes, it strengthens the hippocampus, the memory centers of the brain. So fertilizer. So movement is phenomenal for that reason alone. BDNF. Endorphins are released. I got them. I could feel them in my body right now after sprinting. The endorphins actually strengthen existing brain cells, regenerate brain cells. The BDNF actually regrows new neurons and strengthens the old ones, repairs the old ones. When you're moving, you're oxygenating, you're sending oxygen to your brain, nutrients to your brain. That circulation also helps draw down or bring down inflammation. Very, very important. Also, blood sugar, lingering blood sugar, just like in the body, you could produce type 2, type 1 diabetes. The lingering blood sugar in the brain is metabolized faster when you're moving. You do not want lingering blood sugar, high levels of it, or insulin. And while you're moving, insulin, fasting blood glucose, all that stuff is regulated on a much better level. And of course, if BDNF is the brain fertilizer, specifically for the hippocampus, then the kryptonite for the hippocampus and for the brain is cortisol, the stress hormone. Acutely, it's fine. It regulates a lot of important physiology, but cortisol, the stress hormone, if remaining elevated, chronically elevated, it destroys the hippocampus. It is kryptonite for the hippocampus, the memory centers of the brain. Talk about Parkinson's, the substantia nigra. So there are chemicals that are naturally released through movement that build up the brain, and there are chemicals that are washed out of the brain that will, if staying around, if remaining around in the brain, will destroy the brain. So many things that we can do to enhance the function, the functionality, the health of the brain. And at the master class, it's going to be Tuesday, Fixing Your Broken Brain. It's going to be an awesome one. What are we going to be talking about? I am going to show you actually the specific markers. I call them the baker's dozen. And these specific blood markers can tell you 10, 20, 30 years in advance if you are on your way, if there's a very high likelihood, probability of you developing brain disease or not. These are substantiated in the medical literature. I'm going to show you what that baker's dozen is, how to measure it, simple take-home blood tests, blood spots that you can do, and you can look at these markers that can tell you if you're on your way to brain disease. B12 is a huge one, and there's one marker that can tell you way more accurately than just B12 on a blood panel. There's one marker that you want to know about that's going to tell you if you have a substantiated elevated risk for developing a brain disease. So markers, we're going to talk about the foods, the supplements. What are the specific foods that can nurture your brain, the type of movement you want. We're going to talk about all these different things in terms of how do you turn the bad genes off, turn the good genes on, how can you dramatically impact your brain, the health of your brain today and well into the future with simple lifestyle activities. Okay? Keeping your brain healthy, it's not rocket science. They're just some things, just a handful of things. If you do them consistently, there are a lot of things you can do, but if there's a handful of things, if you do them consistently, right? My great friend Jeremy tells me, who's an amazing person, not former, but Marine, tells me this. Consistency, because I always say consistency counts, right? Now he said, no. He said, consistency is the only thing that counts. It's the only thing. It doesn't matter if you know the right thing to do. If you don't do it, but if you don't do it consistently, it doesn't count. So you got to make sure that you're doing them consistently. So, my greatest fear in life, right? Brain disease. I've seen it in my own family. I've seen it all around me. I've seen it with patients. It is the most devastating thing, health-wise, that could ever happen. So come learn this Tuesday, July 15th, 6:30 p.m. We got room, we got space for you. If you've not registered yet, I'm going to repost the link here so you can register for that incredible masterclass at the office. We got room for you, your family members, loved ones, patients. Bring people with you and let them learn this critical information now. Now is the time. And there's so many things that you can use today to guide your body, your brain in the right direction. So many things we could do to take control of our health, our life, our bodies, our minds. So come join me. In the meantime, get moving. Move the body, oxygenate the brain. I'm going to go inside. I'm going to make myself my vanilla complete clean and put some other things in that concoction. They're going to support my body and my brain health. And again, we're going to talk it all down. Blood markers, nutrition, food, chiropractic, the spine's involvement with brain health, and so much more. This Tuesday, 6:30 p.m. We'll see you there. Everybody have a great Sunday. God bless.